Yeah, so let's get reaction to this. We are joined by co-founder of the new Advocacy for Prevention of HIV and AIDS, Yvette, Raphael, and Yonela Sinqu from Sisonke National Movement. Ladies, good evening, and thank you so much for joining us. I think I want to start with you, Yvette, and say, talk to us about your understanding of just how far the organizations that you know about, certainly in South Africa, that have received these letters. And the initial reaction, were we expecting to get to this point even after we'd seen a waiver in, a little bit earlier on in the year? I think it was, yes, a waiver for some projects that was on the 1st of February. So was there some sense of hope?
Thank you so much for inviting me, and good evening to the viewers. I think, first of all, I must say Advocates for the Prevention of HIV in Africa and South Africa is deeply concerned about this decision. The Trump administration has clearly declared war on the right of health globally, and the South African government must take this as an opportunity for us to expedite and meet the obligations to our people. We also know that many of these organizations, the implementing partners, as they are called, fill a huge gap, a gap where our government cannot reach in the villages, in the rural areas, and also are reaching hard-to-reach communities, as Linda-Gail has mentioned in your intro. And these are not just easy targets to reach. It's not just 70%. It's an equivalent of 7 billion US dollars. So we have 7 billion rand. So we have to be realistic that it's not a small gap. If it was that easy for our government to fill that gap, it should have done it previously, but the impact is really, really big. Lots of people living with HIV are part of these programs. As you know, a lot of our communities are community engagers. They are educators on the ground. They are the people the peer educators who bring the people back to their treatments and to their clinics. And with that, it means now we are standing a risk of a new problem within the HIV, within HIV, our movement, which is the drug-resistant HIV, because people won't go to the clinics. It's not easy to go back into the government clinics because you'd be asked for referral letters. People will send people from pillar to post, and this means people will get tired and not access their treatments, and that is a huge disaster for us as a country. We know that women carry the burden of HIV new infections as well as HIV, and that would mean that we are going to start seeing people really getting very sick as in the earlier days, and we don't want to see that. We also know if the research stops, many of these organizations are research organizations. If the research stops, we will not have things like PrEP. We would not have modalities like Cabalay, the injectable drug to prevent HIV, and this will cause a huge, huge disaster for our country. We cannot stop now. We've made huge inroads. We've made huge inroads with people, getting to understand HIV prevention and taking the HIV prevention methods up, and this is not the time to stop. So if our government is going to fill that gap, they need to do it fast.
Yeah, I just want to look at some of these letters that were received. And I mean, it reads, "Dear implementing partner, this award is being terminated for convenience in the interests of the U.S. government pursuant to a directive from U.S. Secretary of State Marco Rubio." That's part of it. And it goes on to say, "Kindly confirm receipt of this termination notice via electronic email. Immediately provide similar instructions to all sub-recipients and contractors." I mean, that speaks to just, going down the line, each organization, the structures that feed into that organization, then being ordered to share that information, saying that certainly is going to impact the organizations and their own sub-recipients and contractors. Yonela, let's bring you in here. I mean, talk to me about how Sisonke is impacted, if at all, and certainly your biggest concerns around what's going to happen next.
Good evening to you, Lady, and all the viewers. To us, this is not just a numbers game. To undo stigma and discrimination for marginalized communities such as sex workers, such as the LGBTQI community, people who use drugs, is a big thing. And for us, this is not just an HIV response, but it is also a response to change communities, to understand and eradicate stigma and discrimination. But now we are going back to a situation where our people are going to be discriminated against. we are very anxious at the number of deaths which we are going to be which we are going to be facing. Yes, Sisonke might not be directly impacted financially, but we are emotionally impacted by this. And our members are also directly impacted because our members were going to these facilities and accessing their health care. We are also greatly concerned because these are our partners in some of the programs which we run, such as access to health. And now to see our colleagues losing jobs in a time like this, it's deeply concerning. And our concern now is that not only are we looking at HIV deaths, but we are also looking at suicide, because people are going to incur deaths which they're not going to be able to afford. They have families to feed, which they are not going to be able to afford. So this is all a psychosocial support initiative as well, which we need to rally. And we cannot just leave it to just HIV, because this is an intertwined response. And for us to just sit back and fold our hands is not going to help. So we are very concerned. Yes, we are not impacted financially, but we are emotionally impacted, and our members as well are directly impacted by this.
I mean, the tone of these letters also. I believe that, some organizations here in South Africa speaking to their counterparts in various other parts of the continent, those in Kenya and Malawi, for instance, some saying they received the emails which were signed off. Thank you for partnering with USAID and God bless America. Interesting tonality there. But let's take calls on your thoughts on funding cuts to USAID and PEPFAR-funded projects and organizations. And this is, of course, important to be highlighted. This isn't just for South Africa. It's a global issue as well that's been sent out. So 0105946010 to give us a call, and 0721105584. Let's see some of the WhatsApps that have come in on this very discussion. All right, Temba Maseko says, I'm sure our government is well equipped to continue with the fight against HIV/AIDS. My biggest worry is that the job losses that are going to happen now that these NGOs have to shut down. Temba, thank you so much for that one. Wish Ngosi says, Trump is a white supremacist having fed lies by white racist Amerikaners would not change his mind. We must devise other ways to fund HIV organizations in the country. Gift Letavisa says, Trump can go ahead and cut the HIV funding. I've never seen such childish president in my entire life. He thinks he owns the world. Well, we pray the same God that listens to all of us. He can go ahead and kill our people. Andila says, a public declaration of a cut in HIV organizations by President Trump is the most inhumane, degrading and cruel decision that threatens lives. It has the effects of contributing to stress and anxiety to the people living with HIV. All right. Yvette, let's bring you in here. You talked about that 7 billion rand, and it will take a short break and give you a moment to think about this. But we saw a campaign recently launched by the health minister as well to really capacitate the HIV and AIDS space in the country. I'm keen to hear your confidence levels on how we're able to plug that gap. Can South Africa self-sustain its fight against HIV/AIDS? We will answer that question on the other side of this short break. Stay with us. Welcome back. We, of course, continue to get response from organizations that are speaking out after the Trump administration sent letters to PEPFAR and USAID-funded projects in various parts of the world, immediately terminating their funding. And we continue to, of course, get their thoughts on whether or not there's some confidence that South Africa is able to plug the gap that is being left behind by that US funding cut. Taking your call, 0105946010. Glenn is in Johannesburg. Glenn, good evening. Thanks for calling.
Hello, how are you?
I'm well, sir. Thanks for calling. Talk to us. What are your thoughts?
Yes. Now, my advice is to the rest of South Africa. Let us stop hankering behind Donald Trump. Donald Trump is not going to change his mind. This man is fighting his own battles. All we need to do, let us engage all South African pharmaceutical institutions. Like the lady has said, we are at war. In war, there are casualties. That's what we must accept. I'm not condoning, I'm not saying, actually, at war, there are casualties. I know that a lot of people are going to lose in this war. But now let us engage domestic pharmaceutical institutions in this in order to assist the government to plan this, to come up, to assist in this fight, in this war. Secondly, I just want to send my message to AfriForum. AfriForum has demonstrated that they are not South Africans in the first place. The game that they are playing is very dangerous. Now, for now, what they are doing, the reason why they went to overseas, to America, they are actually doing a damage control, of which is too late. They are doing a damage control because the reaction by Trump is going to hit back to its own constituency. If Trump continues to cut, to tamper with AGOA, the very same electorate and supporters of AfriForum are going to suffer because they are the most who are benefiting, and they are the most who are going to be hit hard by this reaction. Let us leave them. When are we going to learn to stand on our own as South Africa? Let us stop this thing, because if we had started to rely on ourselves long time.
Yeah, Glenn, I'm going to have to jump in there. I think your point is made, an important one. Certainly, thank you so much for calling in, Glenn in Johannesburg. And he says, let's stop hankering behind Donald Trump here, and let's be self-sustainable. But of course, the key question is whether or not we can afford to do so. That's the real question. Yvette, are you confident?
Yes, no, definitely. I think the launch of the campaign that the minister was part of, a few days ago, is a step in a right direction. First of all, we know Dr. Aaron Motsoaledi is one for gimmicks, is one for the stage, is one that would want to show that we can do this, but we don't have confidence in that program, because we know one of the things that we will start seeing happening is stockouts and people not knowing or not getting their treatments. It is important that when Dr. Aaron Motsoaledi do these things, he is true to South Africans and not trying to show that South Africa is the big bad boy here, we can do it. People on the ground are going to struggle. People on the ground are not going to get their treatment, and we need to ensure and we need to demand for our government to close that gap. They can close that gap. An example is just the budget speech being cancelled the other day. It shows that they have trouble in making their sums, and we want to see our government step up, because no country should leave healthcare, especially in a constitution like ours as South Africa, should leave healthcare in the hands of aid. It's not right, it's not possible. But as we know, also a lot of stigma around our programs, around who we serve. Yonela spoke about that. And we also know that it's not just about the drugs. It's who's going to give these people the ARVs when they go back to the clinics. That system is hugely affected. A lot of human resources is lost because some of the nurses, most of the nurses were paid in these implementing partners, were paid by PEPFAR and USAID dollars. We know that we are going to face huge problems. So we need to hear from our government, not longer than a few days, to hear from them how are they going to fill the gaps, because it is going to be a disaster. We are going to start seeing people getting lost to found for their treatment, not going, people fearing stigma, as we can see on the social medias already. Stigma is showing its head. People are talking about, why care about people living with HIV? Shouldn't they just die? So we need our government to really, really think about this and be serious. And more importantly, we are a constitution. We have a constitution, and that they must adhere to that.
Yeah, Yonela, your final thoughts on this one. I mean, your confidence in whether or not we're able to plug the gap. I think that's an important question. But then there's also the issue of who needs to step up? One of our callers there, Glenn, saying perhaps we need to go back to the drawing table and speak to, you know, suppliers and pharmaceutical companies. I'm keen to hear what you think of that. But who needs to step up? It's not just about the funding, but it's also about, from a government point of view, structures that really can take advantage of opportunities perhaps that are unseen.
You know, Naledi, if we had confidence in our government, organizations such as Sisonke, such as APA wouldn't be existing at this time, and the US wouldn't be funding so many households through the projects that are running. Our government has proven over and over again that they only serve a certain number of people. And also, it's not just about the money, but it's about the capacity. Our clinics are overburdened. Our staff in those clinics are overworked, and they're complaining about fatigue and burnout. Some of those nurses that were serving at those clinics that are now closed came from public facilities, and they couldn't take the pressure anymore. But now it is now again proving that we are having a government that is complacent to serve its people. For instance, if you go to some of the facilities right now, long before the announcement of the stop order, people were dying at those facilities. People were not served at those facilities. We've had a condom shortage in Joburg. How long did it take to resolve that? And now we're going to have to add a community of people that has been unheard of for some people, but even though they know of their existence. So to say that the South African government has to stand up on its own and learn to do things on their own, we have tried. And that is why South Africa is also part of the World Health Organization. So we cannot be ignorant now at last minute and say that our government must learn to stand on its own. But this is a collaborative issue which has brought us this far. Yeah. And it is also an issue of our government to complacent to serve communities that has brought us to this conversation.
Sure. Yeah. Yonela, it's been an absolute pleasure speaking to you, ladies. Thank you so much for speaking to us. Organizations, not just in South Africa, and that needs to be highlighted. Of course, one of our callers earlier speaking to the matter around AfriForum, but these letters sent to organizations in other parts of the world as well. Dear implementing partner, I have been delegated authority to issue this termination notice, because that's termination of the funding. And in some cases, those letters closing off with a thank you for partnering with USAID and God bless America.